The one test that predicts your health. The single test that reveals future health risks. The one test you need for long-term health, the test every doctor should check. A single test, rarely emphasized in medical schools worldwide, holds the power to predict numerous diseases, including heart attacks, diabetes, high blood pressure, stroke, dementia, cancer, and autoimmune disorders. When elevated, this test serves as one of the most critical indicators of metabolic health. Commonly recommended tests such as fasting and post-lunch blood glucose determine whether a person has diabetes at a given moment, while the hemoglobin A1C, HbA1c, reflects average blood sugar levels over the past 3 months. But if you are not yet diabetic, which test can predict your blood sugar levels for the next 3 months, 3 years, or even 10 to 20 years? That test is fasting and post-lunch serum insulin, a key marker of future blood sugar regulation and overall metabolic health. It may not be an exaggeration to say, while many healthcare practitioners are well-versed in prescribing insulin injections for blood sugar control, they often overlook the importance of measuring insulin levels as a predictor of metabolic health. Understanding insulin levels is crucial for maintaining overall health. Insulin, a hormone produced by the pancreas, helps regulate blood sugar levels. When insulin levels are out of balance, it can lead to various health issues. Monitoring and managing these levels can prevent serious conditions and improve quality of life. Insulin levels provide early insight into conditions such as insulin resistance, metabolic syndrome, obesity, prediabetes, high blood pressure, fatty liver, cardiovascular disease, stroke, certain autoimmune disorders, dementia, Alzheimer's, polycystic ovary syndrome, arthritis, some types of migraines, and even some cancers. Convincing diagnostic centers to conduct a serum insulin test remains a challenge. The moment I, or my patients, request this test, the immediate response is often, "Why is this test needed?" No doctor usually recommends it. Instead, they suggest testing fasting glucose and HbA1c. Despite growing awareness, and even when I explicitly request it in bold letters, it is frequently ignored. Common mistakes in diabetes diagnosis. Healthcare practitioners often diagnose prediabetes and diabetes by focusing primarily on blood sugar levels. A rise of just 10–15% in blood sugar is enough to make the diagnosis. However, this overlooks a critical factor, insulin levels, which may have already surged by nearly 375%, a significant change that often goes unnoticed because insulin isn't routinely tested. Insulin levels can increase by as much as 375% over a period of 1 to 20 years, long before diabetes is diagnosed. Relying solely on current blood glucose and HbA1c levels is a common mistake. This approach prioritizes blood sugar control over early detection, missing a crucial opportunity to intervene before metabolic dysfunction progresses. Early detection is key to preventing the progression of diabetes. Progression and prevention. Understanding the progression of insulin resistance and the importance of early detection is key. By focusing on these aspects, we can better manage and even prevent the onset of diabetes. It's not just about treating the symptoms, but addressing the root cause early on. The progression of insulin resistance and diabetes. Serum insulin levels gradually increase over 1 to 20 years, marking a clear progression. Early-stage insulin levels rise before any change in blood sugar. Insulin resistance develops as the body becomes less responsive, then prediabetes, and eventually full-blown diabetes. By measuring insulin levels early, we can detect these stages in advance and take preventive action. Why is this test overlooked? In the United States, insulin testing isn't covered by insurance unless medically necessary. When my son in Canada asked for this test, the doctor replied, "Why do you need this? We don't usually suggest it." This reflects a wider indifference to diabetes prevention and a lack of proactive healthcare training. While tests like HbA1c and glucose tolerance are routinely covered, insulin testing is excluded unless ordered for specific conditions like insulin resistance, PCOS, or hypoglycemia. This raises a vital question. Why is a simple predictive test that could help prevent future health risks so widely ignored? The role of insulin in weight management. People struggling with obesity often find weight loss difficult due to elevated insulin. When insulin is high, the body prioritizes glucose as fuel. That means, insulin promotes fat storage and blocks fat burning. Calorie restriction alone often fails, hunger remains and wins. fat doesn't budge. Lowering insulin enables the body to burn fat, making weight loss easier. Understanding insulin levels. What's normal? Most labs list normal fasting insulin as 0 to 25, 0.25 mU/ml, but that's misleading. Many are pre-diabetic and diabetic when insulin approaches 25. Here's a better breakdown. 2 to 5 mU/ml, optimal metabolic health. This range indicates that your body is efficiently using insulin to manage blood sugar levels. 5 to 10, fair metabolic health. While still within a reasonable range, it suggests that your body is starting to struggle with insulin sensitivity. 10 to 17, mild insulin resistance, critical to address early to prevent diabetes. At this stage, lifestyle changes can significantly improve your health. Above 17, significant insulin resistance, with a high risk of developing diabetes. Immediate intervention is necessary to avoid serious health complications. Using this, about 60 to 80% of the world, nearly 6 billion people, have mild insulin resistance. To reduce disease risk, fasting insulin should stay below 17, ideally below 10. Maintaining lower insulin levels can help prevent chronic diseases and promote overall well-being. Key takeaways. Measuring serum insulin is essential for predicting and preventing diabetes and a host of other diseases. Most doctors focus on blood sugar, ignoring insulin's early warning signal. Early intervention could stop diabetes before it starts. Healthcare systems must include this test in routine screening. Ignoring this test is a disservice. With greater awareness, we can move from reactive treatment to proactive prevention, one insulin test at a time.
I am Dr. Sudhakar Reddy Tirupthi, specializing as a pediatrician and holistic practitioner with a focus on spiritual medicine named homeopathy. I extend a warm invitation for you to explore and subscribe to my channel, Try Incurable. Here, you'll uncover a treasure trove of unique and insightful health-related content that transcends traditional approaches. My channel is a source of invaluable information with the potential to significantly impact your life positively. Should you be inclined towards a holistic view of health, I urge you to subscribe to Try Incurable and share this resource with your network. I deeply value your time and interest in my approach to holistic health, and I sincerely thank you for it.